So be sure to write this down. Nursing process is a systematic approach used to guide client care. Now, there are 5 distinct steps that must be in order. And trust me, exams and the NCLEX love to test you on this time and time again. So write this down. We use the common memory trick ADPI. So A is for assessment, gathering info and reviewing client history. Always start with assessment. Remember, assessment comes before any intervention, and exams love to test this time and time again. So just think about it here. How are you really going to help someone if you don't know what's really going on in the first place? So write it down. Assessment, or gathering data, always comes first. Now, there are 2 types of data points. We have objective data that is observed, basically observable or tangible data, like physical exams, vital signs, signs and symptoms, labs, and etc. And subjective data is what the client says. So look at the S's there. The client reports these as a direct quote. For example, stomach ache, chest pain, headache, or even nausea. You can't really quantify it physically, so this is what makes it subjective. Now, D in ADPI is for diagnosis, specifically nursing diagnosis. We're basically identifying problems here, and we're placing them in order of priority. Now, these nursing diagnoses love to come up on care plans, as outlined by NANDA. Using the assessment data collected, the goal is to address both actual and potential health problems for our clients. It's mainly used to help shape clinical judgment about the client's physical status, psychological status, and much more. But it also includes the client's social factors, family, and even community experiences. Remember, physical needs always come before psychological needs, as outlined by Maslow's hierarchy of needs. And it's your opportunity and priority to put these in order. This is typically always tested. For example, we're always going to prioritize an airway issue before we treat an emotional issue. Just think about it here. What's going to kill the client the fastest? And that is going to help you distinguish and guide your nursing diagnosis in the first place to put on your care plans. So ATI had a few questions on how to use nursing diagnoses. So question number 1, the client with pneumonia, oxygen saturation is 89%. What's the most appropriate nursing diagnosis? Impaired gas exchange. As you can see from the data, the client has pneumonia and has a low O2 sat percentage. This points directly to the lungs not getting enough oxygen and CO2 out, right? So this gas is not exchanging. Now, question 2, the client with Crohn's disease feels overwhelmed and doesn't have enough support since her recent divorce. Which nursing diagnoses are best for the plan of care? Select all that apply. Correct answers is hopelessness, risk of deficit of fluid volume, ineffective coping, and even imbalanced nutrition. As you can see, stressors from both physical and emotional issues can lead to more problems. The feeling of being overwhelmed from a recent divorce can lead to hopelessness and ineffective coping. And the physical problems of Crohn's disease, where a client may have many bowel movements per day, can lead to the risk of fluid volume deficit and imbalanced nutrition. Now, moving on to P in ADPI. P is for planning, or basically the plan of care. We outline goals, outcomes, and an action plan. So we develop an action plan with specific goals and a desired outcome of that plan. And always discuss this plan with the client to assess that perceived needs are met. So the big thing here is don't forget about the patient's opinion, but make sure that the patient's desire is realistic, obviously. So ATI mentions, what's the most appropriate way to assess if the plan of care correlates with the client's perceived needs? Discuss the plan of care with the client. Yes, don't forget about the client and their perceived needs here. For example, if the client comes in with dizziness and can't stand or walk, we first want to stabilize the client, and the long-term goal is to have them stand and walk without being dizzy or falling over. Simple enough, right? Well, we use the acronym SMART for client-centered goals. S is for specific goals, like the client will stand without dizziness. M is for measurable goals. So the client's going to walk 20 feet without dizziness. A is for attainable goals. The client's going to walk 20 feet and not 20 miles, let's say. R is for realistic goals. Again, The client's gonna walk, not do backflips across the unit. Go granny, it's your birthday, get stupid, shake your money maker, ayy. And lastly, T is for timely goals. The client will walk 20 feet without getting dizzy by day 3. Now, for example, poorly written outcome is a client will walk without dizziness. You see, this is not specific, it's not objective or measurable. With no clear timeline, this outcome or goal basically stinks. So a smart outcome is the client will demonstrate improved activity and tolerance as evidenced by walking 20 feet without dizziness by day 3 of hospitalization. You see how all the measurable and attainable and realistic timely goals are wrapped into one here. Now moving on to I, this is implementation. Basically nursing actions or nursing interventions that the healthcare team will implement with the plan of care that's designed. Now these include nursing interventions, as mentioned before, but specific key terms: assess, monitor, observe, and provide, as well as procedures, meds, and even client education here. So ATI had somewhat of an advanced question here, but notice the key words used: assess, provide, observe, and monitor. So ATI question: the client with end-stage chronic kidney disease. Interventions to include in the plan of care. Select all that apply. Assess for jugular vein distension, that JVD. Provide frequent mouth rinses. Observe the Kussmaul respirations. And monitor for melena. Even if you didn't know what half those terms meant, look at the key words: assess, provide, observe, and monitor. And lastly, we have E in ADPI. So E is for evaluation. Objective and measurable. Big NCLEX tip. Be sure to write that down. We're basically trying to see if the client's getting better or worse. So, how do you know? Well, reassess the client. Evaluate if the goals or outcomes have been met, and simply ask, were the desired outcomes achieved? And adapt the plan of care based on the new assessment. So identify potential errors or problems in the plan of care and make adjustments as needed. Now, a little side note for evaluation is evaluation of clients' educational needs. A few NCLEX questions mentioned client education pertaining to low literacy.